The truth about urine or pee, color, smell, how often, call a doctor. 1. What color is your pee? 1. If everything is normal and healthy, the color should be a pale yellow to gold. That hue comes from a pigment your body makes called urochrome. The shade, light or dark, also changes. If it has no color at all, that may be because you've been drinking a lot of water or taking a drug called a diuretic, which helps your body get rid of fluid. Very dark honey or brown-colored urine could be a sign that you are dehydrated and need to get more fluids. It may also be a warning sign of liver problems, so see your doctor if it doesn't get better after a day or so. 2. Most of the time, urine is a pale yellow color because it contains urochrome, one of the substances produced when hemoglobin gets broken down. Hemoglobin is the protein in red blood cells that sticks to oxygen so it can be ferried around the body. Occasionally, though, urine turns a very different color. Men may notice the change as their urine enters the toilet bowl or urinal. Women may be more likely to observe it after wiping. Seeing red or orange instead of the usual yellow can be alarming, especially if there are also symptoms like a burning sensation or pain with urination. The alarm may be justified. An abnormal urine color can be an early sign of a serious medical condition. To be on the safe side, it should be discussed with a doctor or another clinician. But don't push the panic button. Urine can also change color for harmless reasons having to do with the foods you've eaten or medications you're taking. And colors other than red and orange are very unusual. Following is a brief rundown of some of the color changes and what they might mean. 3. Dark yellow. Urine consists of water and waste products that your kidneys have filtered out of your blood. If your urine turns a dark yellow, it may contain less water and more waste products than usual, which can be an indication that you've gotten dehydrated from not drinking enough fluid. 4. Red. The red of red urine can vary from pink to a very dark red. A simple test can tell if the red color is from Hemolytic Urea, the medical term for blood in the urine. Urine can also turn red if it contains myoglobin, an oxygen-binding protein in muscle cells that is similar to the hemoglobin found in red blood cells. Any number of problems affecting the urinary system, the 2 kidneys and ureters, the bladder and the urethra, can allow blood to get into the urine. The long list includes kidney stones, bladder infections or bladder cancer, and, in men, enlargement of the prostate gland, benign prostatic hyperplasia. Strenuous exercise can also result in urine turning red. Hemoglobin can come from red blood cells that leak into the urine or be caused by damaged cells in the bloodstream. During strenuous exercise, muscle cells break down and in some people enough myoglobin is released to turn urine red. Inherited conditions that affect red blood cells and hemoglobin, like sickle cell anemia and thalassemia, can cause Hemolytic Urea. A rare set of conditions known collectively as porphyrias can also turn urine reddish or brown. But there's also a perfectly harmless cause of red urine called Beet Urea, which can occur after you eat beets. Some people, especially those with low stomach acid, won't break down the pigment called betanin in beets. It gets absorbed in the intestine, enters the bloodstream and gets excreted by the kidneys. Iron deficiency and eating beets with foods that contain a substance called oxalate make Beet Urea more likely to occur. 5. Brown or black. If the red of red urine is dark, it may look brown or even black. In such cases, the causes of brown or black urine may be the same as those of red urine. But urine can turn truly brown. Bilirubin, another breakdown product of hemoglobin, sometimes builds up in the blood because of liver conditions like hepatitis and cirrhosis, or a bile duct blocked by gallstones, a tumor, or some other obstacle. If some of that excess bilirubin gets into the urine can turn a brownish color. Hemolytic anemia, when too many red blood cells get broken down at the same time, also produces a bilirubin surplus that may taint urine. Melanoma, the most serious type of skin cancer, can, in rare instances, put melanin, the pigment that darkens skin, in circulation, and some of that pigment may wind up in the urine. Foods that may turn urine brown include fava beans and rhubarb. 6. Orange. Several medications can turn urine orange, including isoniazid, the mainstay of tuberculosis, TB, treatment, rifampin, another TB drug, high doses of riboflavin, a B vitamin, and phenazopyridine, pyridium, a drug used in the treatment of urinary tract infection to ease painful urination. Large amounts of carrots or carrot juice may also give urine an orange tinge. 7. Milky-White. Urinary tract infections sometimes turn urine a milky white color because they provoke an immune response that unleashes a flood of white blood cells. Other causes of whitish urine include uric acid crystals from eating purine-rich foods, such as anchovies, herring, and red meat, lamb, beef, and pork, and phosphate crystals from excess parathyroid hormone. 8. Blue. Methylene blue, a dye used in various diagnostic tests, can turn urine blue. Methylene blue has antimicrobial properties, so it's sometimes found in medications and home remedies. It's also used by itself to treat some rare medical conditions. Inherited conditions like blue diaper syndrome and Hartnup disease can result in blue urine. 9. Green. If blue pigment gets into urine, the color is often green because the blue mixes with the yellow urochrome that's naturally present. It's not an everyday occurrence, but there are case reports of many common medications causing green or bluish-green urine, including the anesthetic propofol, the stomach acid drug cimetidine, Tagamet, and the tricyclic antidepressant amitriptyline, L-level. The discoloration is a harmless side effect. Asparagus sometimes adds a greenish tinge that's also perfectly harmless. But green urine can be a sign of a urinary tract infection or a bacterial infection that has gotten into the blood, bacteremia. 10. Purple. Purple is the only urine color that has a syndrome named after it, purple urine bag syndrome. It occurs when someone has a urinary catheter. Bacteria colonizing the catheter, the collection bag, or both produce a substance called bilirubin, which is red, and indigo, which is blue, and they combine to make a bright purple color. 11. Foamy. No matter what color it is, you should check in with your doctor if it consistently looks foamy and frothy. It may be a sign you have protein in your urine, which may mean you have issues with your kidneys. 2. How does it smell? 1. Pee doesn't usually have a strong smell. 2. But some foods, especially asparagus, which has a smelly sulfur compound, can change the odor. 3. So can vitamin B6 supplements. When you're dehydrated and your pee gets very concentrated, it can smell strongly of ammonia. 4. If you catch a whiff of something really strong before you flush, it might also be a sign of a UTI, diabetes, a bladder infection, or metabolic diseases. 3. How often should you go? 1. Everyone is different, but most people need to empty their bladders up to 8 times a day. 2. That can change depending on how much you eat and drink, especially caffeine and alcohol. 3. It could be a side effect of medications. 2. 4. Pregnant women and older people usually have to go more often than others. 5. If you notice you suddenly have to pee more often than usual, though, it could be a sign of a health problem such as a UTI, kidney disease, diabetes, an enlarged prostate in men, vaginitis in women, or a problem with the wall of your bladder called interstitial cystitis. 6. If you often feel that you suddenly gotta go and sometimes can't get to the bathroom in time, you may have overactive bladder. It's a common condition for older men and women, though it's not a normal part of aging. Your doctor can tell you how to treat it with lifestyle changes and medications. 4. When to call your doctor. Pick up the phone anytime you see a change in your pee that doesn't seem linked to new medications or a recent meal, especially if the change lasts more than a day or so, or if it comes with a fever, back or side pain, vomiting, feeling very thirsty, or discharge. Your doctor can test your urine to see what's going on.